All right, welcome everybody. My name is Dennis Horrigan. I'm a partner at Connecticut Wealth Management. I'm once again with my partner and president and CEO of Connecticut Wealth Management, Kevin Leahy. And we have an awesome guest today, very interesting, Kim Keck, who is the president and CEO of Blue Cross Blue Shield of Rhode Island, a very busy organization these days, I know. Kim, welcome. Thanks for joining us. Appreciate it.
Thank you.
Thanks for having me.
Absolutely. So first of all, can you tell everybody what Blue Cross Blue Shield of Rhode Island actually is and does?
Yeah, sure. So a lot of people don't know this, but there's a system called Blue Cross Blue Shield, and there are many Blue Cross plans around the country. Blue Cross Blue Shield of Rhode Island is a single state plan. So it is a not-for-profit insurance company in the state of Rhode Island and only focused on Rhode Island. And so it's independent and local. Here in Connecticut, there is a Blue Cross plan. It's called Anthem, for example. Anthem is part of a consortium of Blue Cross plans across the country. I think there are about 14 of them, and they're owned by this parent company called Anthem, who is actually owned by shareholders. But we're part of the same Blue Cross family, but in Rhode Island, Blue Cross Blue Shield is an independent, local, not-for-profit plan. We serve the vast majority of Rhode Island, about 500,000 people. The population of Rhode Island is only about 1 million people. So we provide insurance to anyone from an individual, a Medicare Advantage member, so an older population, to employers that are small to very, very large, like, for example, the state of Rhode Island. It's an 80-year-old company. We're a mission-based, socially oriented company. We care deeply about the local community, and in this time of crisis, among other things, that's also on our mind.
Yeah, well, that brings us kind of to the subject of why we started doing these videos, was because of COVID-19 and what it's doing to business owners, businesses, people, consumers. And as I said to you, I know you folks are super busy. The healthcare system in general has been under great strain. How do you, from your folks' perch at Blue Cross Blue Shield, how do you think the healthcare system is holding up, and is it different in Rhode Island?
Yeah, I mean, it's different even across the healthcare system, because that is a pretty big ecosystem. So there's hospitals and doctors, providers, we tend to sometimes say, primary care providers to specialists, and sort of that answer might depend on where you sit in that ecosystem. Generally, I think similar to Connecticut, the hospitals were hit pretty hard, particularly in Fairfield County here in Rhode Island, when the COVID came on pretty quickly and pretty intensely. In Rhode Island, the same, probably a little bit slower to ramp in Rhode Island. And the way it hit hospitals is essentially, as you might know and expect, right? Hospitals, to prepare for COVID-19, essentially had to almost cease and desist everything else, right? This is a highly contagious virus that has that we know very, very little about. I mean, 6 weeks in, I suppose we know a little bit more, but in the very beginning, the sense from all the hospitals, either by their own volition or even in some instances by governors, said, you got to keep people out of the hospital because you have to, keep your capacity to serve those who are infected by COVID-19. So there's a lot of stress there. There's a lot of stress on the primary care doctors and even specialists, right? For same and different reasons. If you think about it, right, in when we sort of went in the Northeast anyway, into sort of social isolation, so almost kind of, quarantined generally, people aren't going to the doctors. People aren't physically going anywhere really, or very few places. So the healthcare system and the hospital side, like I said, was put into pretty quick gear to care for those infected. The providers, particularly primary care providers, suddenly no one was going to their offices. And these are sort of small businesses, right, in general, in Rhode Island, and sort of here in Connecticut too, although Connecticut has larger groups of doctors that are a little bit bigger in size and might be able to withstand the financial implications of nobody coming to their business. So it's a mixed bag. As an insurer, we have relationships with providers, and we actually provided funding for hospitals and doctors who suddenly saw their revenue just completely dry up in the very, very beginning of COVID because no one was coming in other than for these, acute needs.
Yeah. So Kim, how else did that, the delivery of care, what other changes have you seen? I know we've all heard about, telehealth, which maybe I heard twice in my life before, 6 or 8 weeks ago. And now I seem to hear 6 or 8 times a day. Yeah. What sort of changes are you seeing? And maybe the follow-up question would be, are those going to be here to stay, or are they temporary? If you have a crystal ball, I'm not sure.
Yeah, it's something we think about every day, and certainly telehealth would probably be the change that we saw the quickest. There are a couple, and I can talk about a couple others, but telehealth, particularly early on, Blue Cross as one insurance company quickly said to physicians, look, we're going to pay you the same if you do this kind of visit, right? This video chat, as if you were doing a regular in-person visit. So reimbursement, you're going to get paid the same, and we're going to enable you potentially with some help with the technology. So we saw the kinds of adoption in the last 6 weeks, probably that's typically you see over 10 years. In fact, I think if 10 years may be a little bit exaggerated because some of this technology really wasn't there that many years ago. But if you compare what we've seen in such a short time to the 6 years, I'll say, prior, we've had incredible adoptions, largely because there were no other choices, number one. And number two, because insurance companies like Blue Cross said, we're going to pay you the same. And candidly, patients sort of like it, right? We use technology for everything else. You think about even the adoption in Zoom generally for businesses, right? And so many other parallels. But I think it actually is here to stay. Believe it or not, we've really, I think, been generous. I don't know how others would describe it, but we didn't use just telehealth for primary care. We've used it for specialist visits. Believe it or not, we've even found a way to help dentists in telehealth, which is, again, I'm going to use the word generous. I'm not sure what the right descriptive is there. But I don't think that changes. Now, it's an interesting policy decision because I think the governor of Rhode Island, I'm sure Governor Lamont here as well, is trying to think through how to reassure patients that it's safe to go back to the physician's office, and some things are better done in person. So we're trying to promote telehealth, but also, sort of help patients and the members we insure say it's also going to be okay to go back to your provider's office. And there's a certain limitations to this technology that it serves a great purpose, but there needs to be supplemental, actions to make it effective.
Yeah.
It seems to me that one of the, I guess, pros, that's a poor choice of words, but one of the things that coronavirus and COVID-19 has caused is kind of an acceleration of change that was already starting to happen a little bit, and it sounds like it's very good for telehealth. It also may be shining a light on some challenges that we have in various systems. And one of them, you started to touch on it before, and that is the family practitioner, the pediatrician, the independent docs have been struggling over the past 5 or 10 years. In fact, I think there's almost been a dearth of new entrants into that industry. So what do you think that's going to have in terms of a long-term impact? If they are struggling as small businesses now, will we find a way to kind of resolve that problem?
Yeah, it's a good question. It's something I worry a little bit about because, and why we at Blue Cross are trying to support primary care in particular and smaller primary care offices more specifically, because the investments that are needed to support a practice, I think, are not insignificant, and really to move away from the way medicine has traditionally been reimbursed, right? So think about COVID, everybody goes home. Typically, traditionally, doctors get paid when people come in, kind of fee-for-service medicine is, someone shows up, you get reimbursed. And that's something we at Blue Cross, as well as other insurers across the company, have been trying to change for some time, to say, look, we'd rather pay you physician to manage the overall population that you have to get healthy, not just to kind of crank through services to maximize revenue or even just to get revenue, right? But instead, how about if I gave you a fixed amount of money and you say, here's what I'm going to do in terms of my immunization, here's what I'm going to do for the overall kind of quality indicators of my population. And so that trend has been underway for some period of time, but the small primary care office isn't really fully participating in that in the way sort of some of the medium-sized ones are. So what we've tried to do is help enable that even for the small primary care physician offices to say, we'll give you the dollars to make that investment. We'll pay you a fixed amount of money so you don't have to just, go through the crazy cranking through patients to see, one after another, just to, cover your overhead. It'll be a difficult transition. I hope that we can get there. The alternative, and many times is many markets, and could be at this time too, which I don't think is good for our healthcare system, but I come with a little bit of bias, because the alternative is hospitals who typically have a lot more resources will actually buy primary care groups. That typically consolidates in a way that isn't really good for someone who pays for healthcare. So typically, studies have shown that consolidation just actually increases costs, could increase costs anywhere from 20 to as much as 60%, studies would show, without an increase in quality. So I don't really want consolidation. I think we want to keep our primary care physicians independent. One other thing I'll say is, in Rhode Island, we are required by regulation. Again, we could call it helpful or not, but I actually think, generally speaking, it's helpful to spend about 10%. We spend more than that, but at a minimum 10% of our costs on primary care. So for the dollar of medical costs, the amount of claims we pay, 10 cents on that dollar has to go to primary care. Doesn't sound like a lot, but when you think about how much more expensive hospitals are than physicians, that helps to provide this kind of reimbursement to keep primary care to be an important part of the system.
Will this, you talked about how the COVID crisis, has helped with the maybe I'll say silver lining with the telehealth, forcing telehealth to push along. Will that have a positive impact on helping the smaller physicians or the?
Yeah, it's hard, because that's partly why, Kevin, we but we've chosen to make some investments, because not all of these smaller primary care docs even have the technology to begin with, or really might have had any interest in using it. So sometimes it's a willingness or culture, or sometimes it's dollars, sometimes it's both. I think it has changed quite a bit in what I've seen in the last 6 weeks. So I'm pretty optimistic about that.
I don't know if you can hear, I'm not sure my dog agrees with you. Let's. I know. So I know you have a virtual college graduation to be getting to. So we don't want to hold you for too long. But I think maybe would end with at least maybe throw a softball at you. Is there anything, and I guess I'll open this up not just to Blue Cross of Rhode Island, but certainly the insurance industry at all. If what is it that people should know about organizations, either yours or organizations like yours, that maybe they don't?
Yeah, so one of the things I started with at our conversation a few minutes ago was for Blue Cross Blue Shield of Rhode Island is we are a community-based organization. I think because we're not for profit, we're not owned by shareholders, we happen to be owned by our members. We plow back a significant amount of our resources into the community. So particularly during this time, during COVID, when so many Rhode Islanders in particular, but Americans generally are in need in terms of, you name it, food, insecurity, transportation, although not that anyone's going anywhere, but stable housing and the like. We invest actually in stable housing, believe it or not, as one of our areas of focus, and not just because it's the right thing to do, because we believe everybody should have access to stable, affordable housing, but there's plenty of research that says you cannot actually be healthy if you don't actually have a place to live. And so at Blue Cross in Rhode Island and in many places, we tend to have a very kind of community orientation that that really is something that makes the company something I'm proud of for the company, and I'm thrilled to lead a company that has that focus. And really that community service is sort of in the DNA of our company. It's a great complement to what we do from the insurance and the kind of business side of insurance, if you will.
Yeah, awesome.
Well, you have a ton of experience in the healthcare industry. You were chief of staff at a publicly held insurance company that will remain unnamed at this point. So I know you have so much experience and know what's important in terms of delivering good service and also a good work environment for your employees. So we really appreciate you taking time. Again, as Kevin said, we know you have a graduation to attend to. Sorry that Laura has to do it virtually, but such is life these days. But thanks for spending a few minutes. That was really interesting. I have a ton more questions, but we don't have all day. But really appreciate you taking some time to chat with us and go through some of this stuff. So
yeah, we'll follow up on maybe a Netflix series.
I've run out of streaming videos or streaming programs on Netflix. So yeah, I'm sure we could add some. But thank you very much for the conversation. It was great to be with you today.
Great. Oh, thank you, Kim. Be well.
Take care. Be well.